Good afternoon and welcome to the Advice Media webinar today. I'm excited to introduce our special guest, Dr. Shashi Kusuma, dear friend, and thank you for taking time, Dr. Kusuma, to be here with us today. Our topic today is enhancing patient engagement through mobile technology. And take just a minute to kind of introduce a little bit of the background of why we wanted to talk about this today. Some of the things that we've seen with Advice Media is over the last few years, we've seen a tremendous growth in the amount of mobile users on the web. And it continues to change in the way that it's being enhanced through practices. And we're going to have Dr. Kusuma talk about that specifically as a board-certified plastic surgeon because of his experience with that. From the Advice Media standpoint, we've seen the numbers go from 15% going back to about 2008, 15% of mobile traffic to our doctors' websites coming from a mobile device to growing now to about 70% of traffic every single month is on one of these little devices right here. And it continues to grow and expand. So with that, it's forcing a lot of changes within the practices. What I wanted to do is show you a little bit. Every one of you that is here as an attendee, we appreciate your participation today. And we also appreciate you filling out our brief survey at the beginning of the registration. We actually have some results we'd like to show to you to kind of show you what we've found amongst this. And also, if you would like, we do have handouts available that show this information. You'll see that on that right-hand side of your component. And that piece that you're looking at is just a brochure, excuse me, the result of that survey. So feel free to download that PDF and look at the results of the survey that we took. Ron, if you go ahead and show us that next slide, we'll go through a couple of these real quick, and we'll take a look at some of the results that came from these questions that we asked during the registration process. So, Ronnie, are you? Make sure Ronnie's got it. Well, there we go. Thanks, Ronnie. So the first one was, how satisfied are you with your current level of patient engagement? You can see these results right here. So most of you are, about 52% of you are somewhat satisfied. So looks like there's a lot of room for improvement when it comes to increasing that patient engagement level. So that's good to know, I'm kind of understanding that. Next slide. Does your practice actively utilize a patient portal app to communicate with patients, send them files, images? And the majority of you do not, which doesn't surprise us. We've seen that that's really the norm within a lot of practices. And Dr. Kusuma, we had you talk about that as well. And then the last question that we asked was really getting down to, have you conducted a remote video consultation? And this is something that's growing immensely, at least in the idea or concept, but very few are actually doing it. We'll talk about some of the reasons for that and how to maybe change that and make that more of a practice within what you're doing. But Dr. Kusuma, again, thank you for being here. Dr. Kusuma understands this probably better than anybody I've seen. He gets it and understands and has done some amazing things within his practice he's going to share with us today. So again, Dr. Kusuma, thank you for taking time to be here with us today. But as we get started, tell us about your experience as a plastic surgeon with an aesthetic practice and how you've been able to really utilize the principle of mobile smartphone technology to enhance your practice with what you're doing.
Absolutely. Thank you, Chad, for having me. It's really a distinct pleasure because this is really my passion. So, you know, I actually was tuned on to this several years ago because of patients, really, because I noticed many patients were, you know, bringing their selfies, bringing, you know, images from the emergency room, bringing, you know, kind of contextual-based data in a multimedia format. And they were utilizing their smartphone to do that. And not only were they doing that, they were actually instantaneously sharing and discussing and using this as a tool to engage with not only the physician, in this case myself, but with their family and their friends, and they were longitudinally following their experience and using it as kind of a self-fulfilling diary of sorts. And so that's what turned me on to this whole aspect. And many times I realized and noticed that we would give them, these nicely templated packages of instructions or tools, and that was the age of the technology just as recently, even today, many doctors use. But the minute they leave, they call back, they don't understand this, they don't know this, they lost their paper, they didn't quite, they just don't, kind of utilize it the way it was intended to use. And many times they, want to record me, of what I'm saying so they can remember it. They don't want to write anything down because they can't read the writing. And so there was many roadblocks to proper engagement. A lot of times they wanted to contact me after hours and they weren't able to for various reasons. There were many roadblocks there because they didn't know how to send me like data that I could actually use it as an actionable point of data, because it was very archaic, or somebody gives their interpretation of what's going on, and it was very frustrating to take care of patients, in a very seamless and effective manner. And so that's really how I got tuned into the whole thing, and that was 3 or almost 4 years ago now, where mobile tech, well, first of all, healthcare IT was in the dark ages even 4 years ago, in my opinion, and mobility was non-existent in the true form of mobility. And so it really opened up my eyes to say that we are the leaders in plastic surgery and the aesthetic space because we are a truly market-driven economy. The type of consumers that we take care of, or the patients we take care of, drive this behavior, and they are the forefront of this change because they are actually directing the change and the need for change, and therefore we better get on the bandwagon and be the leaders and not the laggards. And so that's how it all got started.
Oh, that's great. And just like you said, we've seen that same evolution just in the last few years, where really the technology couldn't keep up with where things were going. But in the last 4 years, it's finally this technology allows us to do more things than we ever could before. And so trying to embrace that and find what's the right path to go down is so important. How do you then, you talked about patients coming in and showing photos and showing images and wanting to record you. So how are some specific things that you've done in your practice to utilize the mobile technology in that patient consultation?
So one of the things that I personally felt needed to happen in this evolution of technology in the modern day for a modern solution is that we need to have a proper ecosystem. The focus can never be just for the patient or just for the physician or just for the staff. It has to be a seamless experience across the spectrum, because we're all team players in this whole exercise that we go through to manage healthcare. And so one of the things that I wanted to do is that create an ecosystem of sorts where the center focus of that is the patient and the physician, and then ask the question, how do I do that in the current day environment? And voila, mobility was the way to do it, because it immediately takes away many pain points. So for example, a patient, reaches out to your office because they want to come to visit you, or they are kicking the tires or whatever they're doing. Immediately they can download in a mobile environment something called a kind of app-based experience, more than a portal-based or a link-based or anything, because that just takes away that wow factor, because it doesn't provide mobility in the true sense. So it's really something I want to do it in an app-based environment, because that's the future, at least for the next 10-15 years, where technology is going. So that was a key thing. And so they could download an app which incredibly changes the experience that they have, because it really functions on the palm of their hand. And at the same token, I wanted the same type of interactive tool for not only for my day-to-day needs, but the patient engagement aspect, which in case may mean sharing images, sharing videos, sharing instructions, sharing cosmetic quotes, sharing all kinds of various things that I could do during the day or after hours, or whatever the case might be, and truly have what we call just-in-time JIT information or actionable information that I can actually act upon, and not have to do 10 additional things to get back and to take care of my day very efficiently. So I utilize this mobile technology in every aspect of my practice now, which is that they download the app, They are able to send me all kinds of multimedia-based contextual information. We send and push a lot of marketing materials to them. We also, give them and share their financial information, quotes, etc. We have secure messaging that we use as part of this ecosystem, where they're able to privately share videos and images and documents of various kinds. They're able to share all of this with social media of their choice, and they're also able to share that with a lot of their colleagues and friends. And now there's a medical record, and all of this information is privately, securely stored as part of their medical narrative. And one of the other things that I really wanted to change is that we have lost the power of the patient-physician narrative. And that's because of all of these archaic technological ways that's been developed over the last several years, which did not really realize the vision of what it could do. And so we wanted to bring back the narrative. So now I have a true narrative with the patient. So I've shifted a lot of the time that my staff was doing administrative duties to doing patient engagement duties. I'd rather them sit and spend time with the patient to talk to them versus go back and upload images from a Nikon camera to this or that, or sort this and that, and print laborious paperwork to give to them, which they never read. And so there was many of these things that were eliminated, so that I had less dependency on administrative duties or tasks and more face time and more engagement with the patient, and was able to shift slightly the focus, or maybe to a large part, all the activities in the office that are geared towards patient interaction, patient engagement, patient retention, cross-selling, upselling activities, and have that wow experience that they really expect and kind of want these days and deserve, frankly. And in that way, I was also able to decrease the need for frequent visits if necessary or unnecessary, and I was able to have many activities at my disposal that made me a much better, efficient person, a more fun person, and actually saved me a significant amount of time, in my opinion, which is the key factor of what technology should be doing. It should not automate the hell out of everything that I don't do anything, but it should do enough so that I spend that extra time with whichever format or way that I want to use it. Whether it's to see more patients, whether it's to go home early, whether it's to spend more time with each patient, spending more time, whatever the case might be, the individual uses. So I've been able to use it in many ways. I'll give you more examples. I've been able to eliminate almost 3 or 4 different fragmented pieces of technologies that are serving different functions, because I was able to utilize this mobility as an ecosystem where I don't need 5 vendors offering 5 different services. Like, for example, I don't need a vendor giving me multimedia tools. I don't need a vendor giving me secure messaging tools. I don't need a vendor giving me marketing tools. I don't need a vendor giving me patient management tools. And so I was able to think about this in my natural workflow. And right now, the mobility allows me to even do virtual consults, as part of my day-to-day life, because I don't need another technology that I need to purchase to do it, because this mobile ecosystem enables to do that, because I not only use it to do virtual or teleconsults, I also use it for post-operative care if necessary. A tummy tuck patient doesn't want to come because they're in pain and they still want to see me. I'm able to do this in this multimedia format remotely today with mobility, which we could not do before. So it just opens up so many avenues, so many things that make this entire exercise of medical practice, surgical practice, truly a joy.
Some of the things you said really resonate with our guest from last month, Bob Rullo. He talked about the importance of creating raving fans and doing that within your practice. And it sounds like now that you've been able to really utilize and strengthen the use of mobility and the communication, it's about the patient and getting back to that, where it's not about treating a symptom, right, or providing a service. It's about treating a patient and meeting their needs. And by utilizing technology and being able to get rid of a lot of the other stuff that gets in your way on a day-to-day basis, it sounds like you've been able to do that very, very well, which is fantastic.
It's really cut down the need for a lot of verbosity, a lot of unnecessary pieces of documentation, because it doesn't serve any true purpose. Like, for example, let me give you real-life examples. Let's just take a breast augmentation patient, a simple breast augmentation patient. With the mobility and multimedia now, that becomes part of the patient chart instantaneously, that I can instantly share with the patient. I can take an image and make that part of the medical record, where I have the contextual basis of asymmetry, nipple position, the base width, all of that in one image. So, it's frequently an image is worth 1,000 words and a video is worth 1,000,000.
Right.
It's truly in real life, that's what happens now. I don't need 5 pages of templates telling me the right is bigger, the left is smaller. I can just look at one picture and I know everything I need to know about the operation that I need to do. And with a small caption that I can dictate into that, I just want to say, well, I'm going to use Natrel or kind of Mentor or Sientra implants for this, and I'm done. I mean, that's all I really need. And before surgery, I can really video animation. I can review whatever I need, and then with this mobility, not only can I review it instantaneously wherever I am, but I can share it instantaneously with the patient so that they don't have to worry and scramble about it. So it's empowering that patient, making them the interoperable entity, so to speak, having transparency in many ways, having accountability, and just truly making the relationship the most sacred thing that we went into medicine for. So.
That's and that imagery, being able to have that connectivity is, I think, so critical. Something else you mentioned, I think, is so important, is there are so many vendors out there. You and I have had this discussion before, which is it's so fragmented. You have other groups, they're doing good things, but when you've got 5 or 6 different vendors all doing different things, and none of the things are working together in one ecosystem, together, then it makes it more difficult. You're actually not getting time. It's actually costing you more, although they're all important. And so being able to consolidate that to one is very important. I'd like to take just a minute and pull our attendees real quick, just to kind of understand how they're using smartphones within their practices and with their patients. So just kind of launching this poll real quick. So is your practice currently using smartphones? If you'll take just a second, want to hear your answer of how you are using smartphones in your office to interact with patients. I'll give you another 5 seconds. Okay, so looks like on the poll results we have about 58% saying that yes they are, which is great, and there can always be one level or another that's happening, and then 33% not yet, and then 8% aren't really sure. It's probably trying to figure that out. We probably have a couple people on my staff who are here not sure how to answer that, which is fine as well. So anyway, it's good to kind of see those differences there and how that plays into it, and understanding that it's still catching on. So with your experience, how we're going to get into talking a little more about some of the things that you've created, but where do you see mobile usage going over the next few years with patients, and how it's going to relate to EMR, privacy, just the entire consultation? How do you see that all playing out as over the next few years?
Well, I'm really, really bullish about the future, and I'm really encouraged by the paradigm shift that is happening and also needs to happen for us to get to that next level. Because what's happened is that I think for the last 15 years, we've seen the vision, we've seen the promise, but also the failures. We've seen the good, the bad, and the ugly, and we've really had the luxury to learn from all of those first 15 years of experiences, and technology really has caught on, and now we have the capability technologically to do a lot of things that we couldn't do before, and the center of it all is mobility. The center of it all is a personalized device that's in your pocket all the time, whether you're a patient, whether you're a staff, whether you're a physician. I just cannot envision the next 2, 3, 4 years, even as short as that, where you really have to go back to your desk and sit in front of a computer and do anything. If you happen to be there and if you want to work off a computer, you certainly can. But I would venture to say that we are going to, well, we already are a mobile society. We're going to become more of a mobile society, and I think the mobile piece is going to become the centerpiece of all of our activities, personal and professional, all alike. And therefore, EMR, the concept of it is really, again, an archaic term, because it really means just you're documenting your interaction with the patient, and you're kind of sorting and categorizing it. And there's nothing that I know of that makes it possible as easily and as readily and as immediately as a mobile technology enables you to do. So I envision where mobility becomes the centerpiece of all of our medical activities, for personal care, for professional care, and all the rest of it. So we are very, very bullish for that reason, because then it's going to become more value-based. delivery, outcome-based delivery, and truly patient-based delivery versus a billing-centric delivery and versus a template-centric delivery and also a rigid way of delivery. So I see a tremendous wave of change that is upcoming. And the beauty of a technology company is really that you don't build a technology for today. You build it for the next 3 to 4 years because change comes so quickly. So my simple philosophy in life is that you pay now or you pay later, and you better pay attention to the trends that are happening in the industry and be at the front of it. And so the trend is patients are going to demand the change. Patients are going to want this change, and we better get on the bandwagon or we're going to be left behind. And so I think the future, to me, is going to be centered around mobility.
I agree. Again, my guest today is Dr. Shashi Kusuma. Dr. Kusuma is a board-certified plastic surgeon. He's also the CEO and founder of Symplast. Dr. Kusuma, talking about apps. So there's a lot of discussion on is an app better or is the mobile version better when it comes to this patient engagement. Tell us your thoughts on which one is better, which one's going to be really where things are going to go as it continues to grow on mobility.
Well, I mean, I think you know, I mean, this is my prediction. I think majority of the people that when you talk about mobile, you're talking about an experience where the person is mobile and can get access to information the way they want, and the interaction with that device or media is really, really top line, you know, where they don't have to have glitches and plugins and links and, you know, all passwords and, you know, all kinds of what I consider today archaic ways of doing stuff. App-based technology enables that wow experience that everybody craves these days because it's all about how you interact with the media that you're engaging with. And so I think the future, again, at least for the foreseeable future, for the next 5-10 years, is all going to be app-based because the experience completely changes. The way you interact with it and engage with it, simplicity and the power of it all. And so I envision an app-based world, not a portal or a link-based, or because we have to be very careful when we talk about mobility because mobility can mean multiple things. You could say, well, I'm sitting in front of a computer, I have an email, I'm mobile. Or what, you know, mobility truly means that it's a bidirectional, instantaneous way to interact and manage your day-to-day life. And the way to do that the best way possible is with a mobile device in the pocket of your you know, shirt or your pants, and that can give you that contextual, immediate, you know, kind of way to engage with it. And so I see an app-based world experience far, far superior to anything else out there today. Of course, you know, in the future with, you know, virtual intelligence or artificial intelligence, that's, you know, 10, 15, 20 years down the road. But until then, I think we're going to be into this app-based mobile world is where I think the world is going to go.
Perfect. You mentioned earlier, and I think this is something I'd like to hear a little more about, was with the mobility technology that you've been able to create with the app and be able to interact with patients and get the engagement, and maybe we can define what engagement means to you and what you found it to mean, but the information you're getting, the just-in-time piece, tell us a little bit about some of the data that you're collecting that you mentioned is helping you become a better manager of your practice because of that information.
Well, I mean, a simple example, right? I am, you know, at a surgery center outside of my office setting, and I'm resecting a skin cancer, or I'm putting a breast implant in, or whatever I'm doing, and I need to get, again, a review of my information. I mean, I literally can flip my phone open, my smartphone open. I could, you know, log into my, you know, private, system, and I could open up everything in the patient's record that exists for me to review, the laboratory report, the pathology report, whatever the case might be, that otherwise, just as recently as before mobile technology, I had to call the office, I had to have them read it out to me, or they had to fax it to the OR, and I had to review it, and you know, or I had to bring a paper chart with me to kind of review it and have it in the room. So there were so many roadblocks and limitations so that's a simple example of how I do it. Now, you know, as soon as I do a breast augmentation, I simply upload that, you know, implant card and the implant information into the mobile device and instantaneously share with the patient in the OR. And before even they wake up, it's ready for them to visualize and keep track of it, for example. You know, so, I mean, the number of ways that I can utilize just-in-time information is that a patient calls me, you know, while I'm, you know, kind of in the evening on my golf course or whatever, and they have a question. Now I can ask them to send me contextual information with multimedia, and I can immediately give back intelligent response of what to do about it, avoid visits, avoid worry, avoid a lot of different things. That really is an incredibly powerful thing to be able to do, but do it not in a fragmented way where it's a different technology, but do it within the existing ecosystem that I have incorporated in mobility all across my professional life, is how it's happening. So that part of my interaction now becomes part of the patient chart as well. So I have a record of it. I don't have to do any extra work on that behalf. So it's opened up the world to so many possibilities and things that I could do that it's really been empowering.
Well, I think that's great. When you think about the fact that, you don't have to wait to get back to your office to log into a system to look at this information. If somebody wants to contact you, again, going back to that patient engagement, which I think is there, that the patient feels that they matter, that it's about them, and so it allows you to manage those expectations and actually communicate with them at a level that really, because of the limits of technology, are unprecedented. They weren't there before, and so I love that aspect. I think that's what patients are looking for in the surveys that we've been reading and studying as well, that patients want to know that they're cared about, that it's about them, it's not about the doctor, or it's about that person getting the best result, and knowing that, and not that they, well, let me ask you this. Do you find that patients abuse that access where it's so open to you, or are they pretty respectful of your time?
I mean, I think, well, I can only comment about my practice, and my patient base. I think most patients are respectful. I think most patients are reasonable. I think most patients just want to know that the doctor or the office is with them and they're kind of care for them, and that they're around when they need them. And so I think at least I've been lucky in my last 11 years of practice where I've had a fortunate time to have very reasonably intelligent, very reasonably courteous patients who do not abuse this. But you also know, and as a provider, you learn to weed out patients yourself. Like, there would be times where you kind of have an instinct, this person may need a lot more of my time for this reason or that reason. Yeah. Now you can preempt all of these things in a much more intelligent manner. So it actually helps you categorize and predict and kind of do proactive things to hopefully manage the difficult patient also very, very well. So I think it allows, again, opens up a lot of doors for you to do things much better.
Good. I have another question I'd like to put together. I'd like to ask our attendees today. If you could capture, edit, or share images, documents, and videos from your phone, would that improve how you engage with patients? Give you a little bit of time to kind of think through that and answer that. Thinking about some of the things that Dr. Kusuma has shared that have worked well in his practice. Just a few more seconds. All right, so here's the results. Looks like 33% feel like it would improve the engagement with patients significantly, tremendously. 50% yes, somewhat, and then the others, not sure. So that's thank you for your feedback. We appreciate you participating in that poll, and I think that's important to understand that it's moving that way. And so one of the things I wanted to kind of talk about a little bit as well, Dr. Kusuma, is you are the founder of Symplast, and you've gone through this, and I think it's a unique experience because while Symplast is a service that is available, it's fantastic. I want you to talk a little bit about that because it was born out of what you have experienced as a plastic surgeon, which is why I think it has so much credibility and truly answering a lot of these questions. And so you've been able to put the development into this. So I'd like you to talk a little bit about that. As part of that, one of the questions that someone's asked here is, tell us about security. Everyone, and I think it's a good question. Everybody wants to know, okay, because everyone's paranoid for various reasons on security of what's going to happen. That we're in a very sue-happy sort of environment. So how do you address that as part of it? But tell us a little bit about Symplast as well and how Symplast has been able to address directly these issues you've discussed today.
Absolutely, absolutely. So, you cannot have a mobile company that does what we do without security. It's a synonymous thing. There's no mobility without security in a sense. But there's certainly a fear because you hear about so much hacking and all the rest going on. It's certainly a big concern. And so the way I explain and the way I think about it is that security comes at different levels of the experience and the development of a solution. So security starts at the coding level. You have to ensure that the coding practices are as tight and as encrypted as can be. That's the responsibility of the technology company. You have to make sure, because it's cloud-based and mobile-based, that the hosting environment is completely, Cat 5, proof, and kind of all kinds of different ways it's secure, where it's actually hosted and the application runs out of. You have to make sure that the data transmission from these locations to the device is also secure in transmission and at rest as well. And on top of that, you have to make sure that the end user has personal responsibility to ensure security as well. Just as a chart could be left open or a computer screen could be left open, any of these are just human kind of places where you can also kind of fall slightly short. So at the coding level, at the hosting level, at the transmission level, at the user level, you have to do everything you can to be self-responsible and also have a partner in a technology company that does everything possible today to ensure the security is there. So the way we ensure is that on all 4 levels of those, which is that we start from the ground up at the coding level, at the hosting level, at the transmission level, and rest and in transmission, all of it is stored properly in a private, encrypted manner. And then we also ensure that nothing is actually stored on the native device itself. The device is essentially a media to exchange and transmit data, essentially. So nothing is actually stored there. So if you, for example, are fearful of losing something, for whatever reason, you can actually delete the app, reinstall it, when you get back to your office and pick up where you left off. And you should have the confidence that none of the data that's been used in that is stored actually on the device itself. So if you don't have any fear of somebody hacking in to get access to it, for example. So we have to be, personally responsible and also ensure to partner with a technology company that takes security incredibly seriously, because I'm doubly concerned because not only am I an actively practicing plastic surgeon, I'm also working with technology. So now I have doubly on the hook to ensure that the security is there, because it's going to affect me in different ways. So it's been a very strong driver of this from day one, almost 3.5 years ago. So we painstakingly took every possible step we could take to ensure that.
Well, thank you. One of the questions that has been brought up is thinking about this mobile technology. How do you engage former patients? Some of the recent numbers I saw from ASAPs and something I presented one of the presentations I give on a regular basis is the lifetime value of a plastic surgery patient is between $80,000 to $120,000. Again, that's over the lifetime of that patient. So, how do you utilize this, Symplast and your mobile technology to continue to engage those former patients, to bring them back in, let them know about other procedures, and create that ongoing value?
Yeah, I mean, this is again, makes it rather simple to do it, because now I'm able to cross-sell and upsell many things, right? For example, if I have a new service, I'm able to push it out to the patient app for them to consume in their own private times, where they don't have to log into an email and click on a link or anything. They could do it in their bedroom, they could do it with their friends, they could do it whatever they want. I could also send reminders, I could share with them, personalized messages if I'd like to, and even before the patient comes in, many times, we can give them all the necessary data for their consumption, so that the appointment actually is much more engaging. And then every time they come, they go away with something in their hand, which is with them all the time, so they can use it at home. They can also many times patients don't decide to do a procedure when they're in the office. They want to go home and think about it. And when they're thinking about it, they want to act on it. So now with mobility, they can actually pay for it right off of their app. So if they've given a quote for a procedure like Altera or whatever the case might be, they now had the quote. They went home in their app that had all the data, all the images and all the drawings and all the marketing materials that I gave them, which is also on their app. But they also had their quote, and now when they're at home at nighttime and they want to actually act upon it, they don't have to wait till the next morning to call the office. They can actually pay for it right then and there, because it's a credit card and all of this technology is integrated into the app. So now they can act on it actively. So when they are kind of feeling the emotional connection to do it, they're able to do it right then and there, because in the morning when they wake up, they may have more fears that creep up or whatever else, you know. Right. So I think it makes you, it kind of creates that sense of call to action. It also does it not do it, not only that, it gives them the confidence that this office is technologically savvy. They have the most current technology, and so it brands your practice a certain way as well. That further leads to, you know, the discussions amongst the patient base that this is the office that's at the cutting edge across the spectrum. I think you know, the just-in-time information, actionable, and also call to action when you need it, when you're ready for it, frees you up, you know, in many ways as well.
Perfect. For our audience, if you have any questions for Dr. Kusuma, love for you to put those in on that right-hand piece on the control panel, and be able to give those to him. Dr. Kusuma, you know, one thing you shared with me a while ago was that was very important for you, and something you looked at heavily, is the fact that you're maybe in a different office from time to time, or you are in a surgery center moving around. So having, you know, talk a little bit about the calendar functioning that you were able to develop with Symplast, and how that's really improved your ability to improve the patient engagement.
Well, it makes you very, very, very efficient, right? Because, you know, if I go to 2 surgery centers, if I go to 2 different offices, or if I do whatever I do, all of the information I need is with me all the time. And not only is it with me, any changes that are made in the main office is reflected immediately on your mobile device, just as you showed me. The minute I need data, it's right there. So if there's a change, it's right there. If I need secure data, it's there. If I need scheduling function, it's there. So for example, you know, if I am on my way to the office from a surgery center and there's 2 patients waiting, I can, you know, even before I get in my car from the surgery center on my way to the car, I could review their pathology, I could review their reports, I could review anything that I want to, and already have all the images for me to review even before I get there, because my staff has probably already uploaded them, and I have access to it that second that it's done. That's how quick the information exchange is, because in an ecosystem, all information with roles and restrictions is shared across the entire environment. And so it enables scheduling functions similarly, is that I know instantaneously based on location, based on timings and all of these things, what I can do, and I can also securely communicate with the patient even before I get there if I wanted to, or with the staff if I wanted to. So truly it opens up the capabilities infinitely, and it kind of really breaks the mold of what we're used to thinking in such a silo manner. You know, this is what I do in the office, this is what I do there. I could do a consult in the emergency room, and I could schedule the patient on myself. So it empowers you. So on the weekend, if you go rounding at the hospital, or if you go see somebody in the emergency room, you can literally create a patient chart right there. You could upload everything that you need to upload right there, and it becomes part of the medical record. You can make a follow-up appointment yourself right there, because it's so simple. And so it eliminates many, many administrative barriers, many things that you would otherwise not be able to do, where you have to take the, you know, the face sheet to the office, where you have to take this and that, and the office manager or somebody has to upload it, and then you have access to it. It eliminates all of that extra work.
I love it. And I think that that's there's so much value of what this has. Would love to hear more about specifically now with all these ideas, all this concept. Here's Symplast. Tell us specifically about Symplast and what you've been able to create, and where that's going, and how that's an opportunity for other plastic surgeons. You know, we're talking about these things, but letting, you know, our attendees know today what's available for them, and how Symplast can help them.
So the first and foremost thing I want to share with the fellow surgeons on the call is that this is an entirely physician-led and physician-born, physician-created organization. Because I personally, as a physician, as a practicing surgeon, was extremely tired of you know, entrepreneurs, you know, IT professionals, regulators, billers tell me what I need to do and how I need to run my practice, how I need to document. That's the first thing. I want to know that this is a physician-led operation, organization, and we're proud to call ourselves that. And secondly, you know, the Symplast is really not a product. It's really a way to practice. It's like an ecosystem. So we've developed 100% mobile bidirectional capabilities, where we created a family of apps that are unique to the user type: a physician, a patient, the staff that supports the physician and the patient, and also a referring third-party entity like a referring doctor or a medical device manufacturer, whoever the case might be, and we created this ecosystem. And not only have we done that, we've also created training tools for residents as well. So we want to create best practices for everybody from the day that they start their medical training. And so we've all done this being device agnostic, so it works on any kind of mobile device, whether it's an iPhone, it's an Android phone, it's a tablet, it's an iPad, or our very powerful web capabilities enables you to log in on the cloud anywhere in the world and do work seamlessly on the cloud as well. And all of this syncs in real time. The best way I can tell you is that if you see those commercials on TV where, you know, there's a guy watching a movie in his bedroom and then he pauses it and then goes back down and, you know, resumes what he did, and or he's, you know, in a parking lot, open up that and watch. It's a similar concept. So it's a device agnostic situation. It is a location agnostic situation. It's a situation agnostic situation. And so it enables all of these. So we created a family of apps that create this seamless mobile-only ecosystem that empowers the patient and empowers the physician. And we also at Symplast, like I said, we don't think of fragmentation. We wanted to eliminate fragmentation. So, you know, all industries are being born just on one module of what we do. Secure messaging is an industry, multimedia is an industry, you know, billing is an industry, and so there's so many different industries. And now what's happened is that these legacy companies have been able to only patch and put a Humpty Dumpty sort of thing together, trying to say that they're mobile.
Sure.
But unless you recreate that architecture from ground up, it's hard to do seamlessly and grow and scale it properly. So that's what we've been able to do, is to spend painstakingly 3.5 years so far to create every step of this as intuitive, as mobile, and as seamless as possible. And that's where we are. So right now we're able to offer all of this as a one package tool where you get the entire ecosystem, not module based, not any of this. You can get it all. And we are past the EMR phase. We are now into the post-EMR phase. We call it a patient, you know, whatever you want to call it. The name is not so important, but you get the professional life, you know, mobile environment, all of it, and you use as much of it as you want, as little of it as you want, and it opens up many, many, many doors for you. And we've been out in the market for a very short time, and we, you know, are engaging with physicians and many, many companies and you know, innovators and you know, forward-thinking folks to partner with and work with to make it even better every day. Because, you know, with mobility, another great thing that happens is that, you know, it's a living, breathing organism. So every 2 months you have updates, you have enhancements that automatically go across all environments. So people can actually increase the value of the product over time longitudinally as well. So they're not stuck to what they have today.
Thank you. It's you know, it's amazing to see this, and it's not something that we do, something that I understand fully as at Advice Media, because I'm not a practicing physician, but I consult nearly 2,000 doctors on their practices, and so trying to help make sure that the understanding of what is mobility today, what is patient engagement, how do you effectively do that is so important. So I appreciate you sharing those thoughts. Question that came in is, and I think this is an important one, we think about the way the practices are changing. It says, how could Symplast help with the increase of sales of aesthetic products within a practice?
Well, that's a great question. I mean, you know, it empowers you to sell and create ways to do it more. So, for example, you could have a video library of new services, of new products that you can partner with the device manufacturers on, and then now you can push it, all of these marketing materials, through your patient app, for example. Or you could call to action on a website that Advice Media creates and have them go to call to action on their app if they wanted to. So you could, you know, you could bundle and say, you know, faceless require these kind of products, and therefore you can send them materials on their patient app about what those products do and what they look like and all the rest of it, and data associated with it, etc. So you have a great ability now to cross-sell and promote various services and products across your ecosystem to all kinds of patients, and you can do this on your own. You don't need a professional to help you do it. you could create instantaneous, campaigns essentially, and push it out to whoever you want. You can even make it customized for patients. So, for example, a patient gets a facelift, you can send them a nice, message securely to them via the patient app, and say, by the way, in a week from now, I want you to start using this. This is the product. This is what it looks like. I want you to use it, and therefore they can even purchase it, through their patient app and have it and pay for it or whatever else. So you can do a lot of creative things with this type of technology.
Okay. Yeah, it's important. I was just at a conference last few weeks, and it was 2 weeks ago, and so much of that meeting was about injectables and these other products and skincare products, and so I was trying to figure out, how do I sell more of this, knowing that non-invasive is a very, very fast growing market, especially here in the U.S., and so everyone wants to take advantage of that and do it the right way. Another question.
Let me add something else here, Chad, also to the same tone. One of the other ways to do it is to obviously do behavior modification activities so that you drive better behavior. And so you can bring those behavior modification type of activities and tie it into their patient app so they can keep track of it, like their heart rate when they're exercising, for example. Okay. So you can track the points, you can track the products, you can track the services, and you can associate that with some type of credit, some type of incentives, whatever else it is that they can use to then offset costs for different things, or get rebates or bonuses or whatever the case might be. So now it becomes almost like a personalized Fitbit that tracks your activity and rewards you for activity within the office. So it increases that stickiness, increases the retention, and shows them a lot more value. And they can track it themselves at home because the mobility enables you to do that. And you no longer have to depend on the office to do that. You don't have to depend on logging onto a company website to do that and all the rest of it. So it really allows, again, the word that comes to mind is gives you freedom. It empowers you. It opens up so many possibilities to creatively do unique things, that we didn't even think about yet.
Yeah, that's great. Yeah, one of the reasons why I wanted you to come on today, Dr. Kusuma, is I think that most of the practices that I talk about aren't aware that there is a technology out there that does this, and so they're caught in some legacy systems which have been good for them. That's why I think we saw the results that 50% are somewhat satisfied with what they have. A lot of the doctors that I talk to, mentioned that, well, I'm only using a small fraction of the software in my office. I think it's because sometimes it's overkill, doesn't really meet their needs, and isn't really creating that engagement level they need. It's not making it easier for them. Another question that's come in, and if you have more questions to our audience, please add those in here. But another question that's come in is, and I'll leave the name of the brand out, but they said, I'm with a current group. I'll leave that name, but how switching over, what is, let me read this. I have all my contacts, all my former patients in this previous system. How do I get them into a new system? That seems like that could be a major undertaking. That scares me to death.
Yeah, so it scares most people because it creates this notion of additional work and burden and chaos and uncontrollable activities that really stress the whole office out, and that doesn't go anywhere. So we have the capability of migrating or transferring data from an old system to a new system that's automated and scripted. So as long as the appointments and the demographic information, whatever the case might be, is given in a certain format, which most systems can do, that can automatically be updated into the new system, so you don't have to lose anything and you don't have to worry about losing anything. And then, now I'm speaking as a physician because I've faced these problems myself in my prior life before I started on this venture, which is that service is important. Being there to support the office is important. And being a partner with the physician is important. It's not like you sell something and disappear and not ever show up again because you made the sale. That's something that behavior in medicine sometimes irks doctors, and it irked me quite a bit when I was on the other side, like I said. So as the founding member of this organization, I make sure that the culture in our organization is based on really three, maybe you can call it four pillars. It's simple, mobile, complete, and that wrapped in the bubble of service. And so if there's any pain points, troubles, fears, we are here to support and help the practices, because as a physician, that's extremely important for me personally as a practicing physician, and therefore that translates into the company's culture as well. So we are able to do a lot of these administrative tasks of migration, transfer, and making it as seamless and simple as possible.
Perfect. Thank you. One of the questions that's coming, just making a note here is, so within this office, basically the question is, how do I get my office staff to buy in? Because it's going to be a garbage in, garbage out, right? If they're not engaging with that, so obviously that's been an issue. Speaking as a surgeon, how have you gotten your office to buy in 100% of the critical nature of data and making sure that data import is happening?
Well, I'll give you a very simple example. Before I had to have an icon. I mean, this is a specific example, but there's many other ways. But I think I'll bring it around. So let's just take a simple feature of multimedia or images management, right? Before, just as recently, I mean, very, very recently, I had a Nikon camera. I had a studio. I had to take these pictures, then I had to somehow transfer that into another system. I had to bring it up on my computer. I had to attach it to some other file in another system that I could not get access to where I want in the room, and then I had to buy a laptop. Then it's like the number of steps involved there are tremendous, and a lot of times, as you know, we human beings are not very punctual sometimes, and so the pictures get completely siloed, and now you have a week's worth of pictures, which add up to 100 photographs or 200 photographs, then that somebody has to sit and spend 3-4 hours to categorize. Now it's unnecessary because all of this is done either by the physician or the staff supporting them in the room and already categorized, already sorted, already contextually, annotated, and all the rest of it as part of the chart. So that step alone has saved my staff 3 hours of time a week, and that now they can use to make phone calls to do better patient engagement and do fun activities with the patient in the room instead of doing secretarial duties. For example, if there's documents that are brought up that we need to upload into the system, you could send it before they come in via fax or whatever, via email, we can upload it, or you could do it in the room with the mobile device in your hand and make it part of the patient record already without having to even leave the room. And so I think that all these mundane tasks that take up a lot of time and create frustration in the office, and moreover, when you need that data because it was not done on time, it's not available to the surgeon, let's just say when I'm in the operating room. So I'm more happier, so the staff is happier. So again, those are just simple examples that come to the surface of my mind to explain. So if you take away all these mundane duties, the office staff is now happier because they're not spending time doing all this stuff, and they're doing fun things, which is why they work in a plastic surgeon's office, which is to do patient engagement and upsell, cross-sell, and share the experiences with the patients and all the rest of it. And when the physician's happy, everybody in the office is happy.
We have Anita Sarabrakian who would like to ask a question. Go ahead, Anita. Oh, there we go. Go ahead, Anita. Sorry. Nope. Okay. Well, we have another question is can you demo Symplast now so we can see how it works? And we're actually, we've only got a couple more minutes, but the answer is that yes, it can be. And so, and I see the requester on there, and so happy to do that. In fact, thank you. So we got this slide up here. So easy way to contact their team is sales@symplast.com, and they can take you through a demo of this. Again, my point of doing this today is because I get nothing for this other than wanting to help my clients know what else is available for them. Because again, I think it's a knowledge of just these legacy systems that have been good, right? They've really laid a groundwork, but technology's gone beyond them, as you mentioned. They're so far ingrained in what they've done that they would have to blow up their entire system and start over again to really do it the right way. And you've been able to take advantage of that with the new technology. And I think just letting people know what is available so they know there's something else out there, and knowing they can save them time, save them money, help their patient engagement, patient satisfaction is so critical, and everybody needs to know about this, in my opinion. Before we end today, Dr. Kusuma, any other thoughts or final thoughts you'd like to share today?
No, I'd love to encourage the fellow surgeons, fellow physicians to, not be intimidated by technology, not to hear a bunch of cockamamie stuff that you're fed that this is the way it is. Take control back of the practice, become part and become active, because that is the only way this is going to change, where physicians and patients drive the change and not listen to, other folks telling us how to run our lives. And that is the key thing that I want to drive here, is because that's what drove me. I'm a relatively young guy, got 30 more years of practice left in me, at least I hope, God willing. And there was no way I was going to survive in this current environment the way it's going. And so I really encourage us fellow surgeons to work together, talk to each other, and really create a very, very bright future that we want. And that's the whole reason we went into medicine in the first place.
Dr. Kusuma, thank you very much. Your experience as a plastic surgeon, someone who has been there, done that, lends so much credibility to this message, which I think is so critical of understanding mobile technology is only going to get stronger and stronger. The user experience online is going to become more and more. This is where people are. I read something recently that Americans spend an average of 4.7 hours a day looking at a mobile screen in their hand. That is amazing when you think about it. And so understanding that, and then that's where people are, you have to figure out how to connect with them in the environment where they're at. And so you've done that, and I applaud you for that. And I really, again, appreciate your time today of sharing your experiences as well as how that's come about through Symplast. Thank you so much.
Thank you. This is my true passion, and I'll do this all day, every day. And I love doing this. Thank you so much.
Thank you, and thanks to our attendees today. If you'd like more information about Symplast, the information is there. You can also, over on the control panel in the lower right-hand screen, there are a couple of downloadable PDFs. One is a informational brochure about Symplast. The other one are the results from the survey that we asked during your registration. I encourage you to download both of those, and just invite you to take a look at it further. Invite you to go through a demo and see what it's about. It may or may not fit into your practice, but do yourself the favor of at least taking a look at it and seeing, would this work for me? How would this help me? I think from the things you've heard today, I think everyone could agree that there are areas of their practice that could be enhanced and improved by increasing that patient engagement. So again, thank you very much, and best wishes to all of you, and we'll see you next month on our next Advice Media webinar. Have a great day.